persistent cramps and pain on the legs, weakness and numbness in your limbs, ulcers developing on a foot that won't heal, you could be suffering from peripheral artery disease. A vascular surgeon could help properly diagnose and treat the symptoms.
It's something called arthrosclerosis. Arthrosclerosis is narrowing of the vessels. So you've got a normal artery. A normal artery usually has got no plaques, and plaques means thickening of the vessel and all. So as time goes by with all the various risk factors, it gets narrowed. So what happens is when it narrows down, eventually it'll either get blocked or it will cause more problems. The end result of this is lack of blood supply. All the tissues in the body require oxygen and nutrients. When there's lack of blood supply, there's not enough oxygen, not enough nutrients, the tissues die off. So for the coronary system, when that happens, a person gets a heart attack. For the brain, when that happens, a person gets a stroke. For the lower limbs and the hands, and usually the lower limb, that's when people get lack of blood supply, and that's when they have peripheral vascular disease. And that comes with a lot of symptoms and a lot of problems.
Because peripheral artery disease and coronary artery disease can occur together, patients face 6 to 7 times higher risk of blood clot, heart attack and stroke.
The same factors that affect atherosclerosis, so things like advanced age, it's more common among men, diabetes, that's a big problem in Malaysia, hypertension, high cholesterol levels, lack of exercise. So all these conditions, and smoking, that's a major problem in this country. All these things lead to thickening of the vessels and also formation of plaques in the vessels, and that leads to peripheral artery disease. So the same factors that cause a person to get a heart attack can also cause a patient to get peripheral artery disease, and even a stroke. So they're all interlinked.
The most effective treatment for peripheral artery disease is its prevention. But if detected early, the doctors will have more options for treating it.
Now, when you see a person and it's early, you can actually go on to treat them with medication, with certain change in their lifestyle. So you have a patient who comes in early, you can tell them, okay, I'm going to give you certain medications, so like a blood thinner, certain drugs to reduce cholesterol, treat the diabetes, stop smoking, exercise, lead a healthy life, so you can prevent further progression of the disease.
The most common treatment for peripheral artery disease is angioplasty. It is a minimally invasive procedure which allows the patient to get the treatment without sedation and go home in the shortest time.
And angioplasty is done, through a vessel. So a vessel is punctured. You then do an angiogram. An angiogram means you take some images of the vessel itself, and that involves a dye. So you inject the medication inside, you can see the vessel. So once you see where the narrowing is, then you'll put a wire through to cross the vessel. Then after that, following which you put the balloon in. This is a balloon. So this balloon is inserted into the artery. You can see closely here, this is the balloon there. So the balloon will then inflate. And basically then that dilates the vessels and presses the plaque to the side. That restores blood flow. So you can either use a balloon itself or you can use a stent. So this is a metallic stent. Okay. So the stent goes in enclosed. When it goes in, it will get enlarged, and this will then press the wall, and it's like a scaffold for the vessel itself, so it helps with blood flow. Then after the procedure, all these devices are removed, then the patient goes on medication after that. On average, most angioplasties can last up to 6 months to a year. But what we do after that would be to start the patient on medication so that it remains patent longer. Atherosclerotic disease is a progressive disease. So again, it's not an answer that once you do it, it's never going to come back. The reality is that it will come back. And so what we need to do is to prevent it from coming back early. The whole idea of treating peripheral artery disease is for the patient to have a good quality of life. Let me say, is able to walk, do his normal daily work and things like that. And more importantly is to also prevent amputation. That means you don't want the patient to lose the leg, that's a major problem. And also by treating the diabetes, high blood pressure and all the risk factors, you're preventing other problems like heart disease and also strokes and things like that.